Hello, I'm Ashish Patel.
And I'm Fred Trotter.
This video, we're going to be talking about some of the new data that HHS has released, specifically focusing in on the national heat maps available in those PDFs. By way of introduction, CareSet Journal, where both of us work, is a healthcare data journalism organization that focuses primarily on Medicare data. But again, in this video, we'll be talking about HHS's data, so it's much broader. It is actually speaking to the effects of COVID on the entire US population. More about this data and other public data releases can be found on an FAQ that we collaboratively built with several different organizations, including University of Minnesota, the COVID Exit Strategy, and the COVID Tracking Project. And as we review these slides, you may see some of the geographies are recovering or starting to become on a downward trend when it comes to COVID case counts or mortality. This is not an excuse to get a bunch of people together. Please do take CDC's recommendations very seriously. You can see us; we are masked. We are trying to keep social distance, and we hope you do as well.
So let's kick it off. So we're looking at the geographic analysis of that comes out in the community community profiling report. Which again, this is the internal picture that the federal government employees have been looking at for several months, and now it's public, and that's new. That's new information. We are looking at the December 17th, 2020 file, which is the first data file that's released. Was released on December 18th in 2020, and so we're kind of giving an exposure. And obviously, this is a daily file, so don't go find this day's file. Find the days that it is file, and you'll be able to see these pictures as they change over time. So this first shot is the first geo map that we have, and it's as cases by county and deaths by county. And the most important thing to understand with these first few slides is these first two are based on total case counts. There's almost a perfect mirroring between population centers and both the cases and the density and the mortality density, which is what you'd expect. So, for instance, if you look in the center there for Texas, you can clearly see that Houston, Dallas, San Antonio and Austin are being affected, and then New York and LA, which is I think right behind my head right there. There's lots of people there, and so there's lots of cases and mortality. It's the next slide where you start to see what's much more concerning, which is the rate of infection. Now, this is essentially adjusted per 100,000 people, which means this is how things are playing out in smaller communities relative to the local population. And here you're starting to see the winter surge is much more clearly seen here, as it's going into the parts of America that it really hasn't been in before. In some senses, COVID is stuck to the cities up in phases before this. And now it really is hitting really hard in rural America. So you see these dark, and the other thing is now we're just talking about cases on this slide. So last slide, it was cases and mortality on the same screen, and now it's just cases. And on the left, over my head, you're seeing the case rate. And then on the right, you're seeing the change in the case rate, which is the reason why you see the green. The green does not mean good in this case. It just means it's probably bad in that county, but it is getting better than it was in the weeks previous to this, right? So again, and this goes back to something that is caution. Like the fact that you see green anywhere on these data reports does not mean that it's safe for you to do anything. You must continue to follow the CDC guidelines. It's really important to emphasize, because the only reason why anything is going to get better is because all the protocols are followed. So this one's on cases. You want anything to add on the screen?
Yeah, just behind me, unfortunately, is the legend that helps you understand that green here just means that the case rate is on the decline. Red means that the percent change is up either 100% or more. So these are still dramatically red areas. Even the orange and pink areas are where case count is increasing.
Yeah, in fact, I think the right way to read this screen is on the left, it's mostly bad, and then on the right, it's in some cases it's getting better. But if you see red on the right, then that means it's bad and getting worse, yeah, right, in terms of cases. Now, if we scroll to the next one, we're going to see exactly the same picture, except now we're looking at mortality rates, and you'll see here that mortality rates. One of the reasons why there's spotty data here in general is that if an area is really, really rural, people travel to die, unfortunately, because they go to the regional hospital and then they die in the local hospitals. And so one of the reasons why those areas seem okay, it's not because they are actually okay, it's because they're collapsing into the local hospital as they have these really, really bad infections. So, and then you see the same effect, which is to say you see it kind of going over to the rest of the country, and then on the right you're seeing how things are changing. Same basic picture. And again, one of the things that you almost always see is that cases are a leading indicator for mortality. So more cases go up, and then 5 days, 7 days, 10 days, you start to see the cases happening. Now, Ashish, would you take it over and show us the rest of the maps?
Sure. Before I do move on, I just want to point out here, and we'll come back to this in another video, but the mortality rate in the last 7 days is 5.5 deaths per 100,000. We'll see in a table in another video that this is the highest mortality rate the country has ever seen. You know, there'll be a lot more history associated with it. So in the next couple of maps, we're looking at lab positivity. Now, also in another video, we cover lab volumes and lab positivity rates on a subgeographic level, on the state and regional level. One of the key things here, I think associated, it's almost politicized, is how heavily do we conduct labs and how often are we testing? A couple things to note here. These are PCR tests. These are the tests that are recorded and positivity is recorded all the way up into the CDC. This is a leading indicator on later confirmed cases and mortality in the geography. Again, on the left, we're seeing positivity rates surging across the country in the same areas. If you take a look at Arizona, Nevada, Tennessee, Georgia, Mississippi, Florida, and Pennsylvania, these geographies consistently are ringing red. This is where lab positivity rates are highest in the country. It's also where we're seeing the most utilization in hospital beds, similarly. And then on the right side, we're looking at the absolute change from the previous 7 days. So while these rates are high, even though we're seeing green, it just means that they are staying very high. These are very slight reductions in positivity that's making that map look green. It does not in any case give us a sense that the positivity rates are dramatically reduced. They're just slightly better than they were this time last week.
So something to point out on the testing positivity, there are several classes of tests that don't come through in this. The historical data is very difficult to interpret on testing positivity for reasons that we talk about in that time series slide. There are places over here, and actually if I lean over here a little bit, you can kind of see that there's some places in California that are actually doing pretty well on testing. And that's a really good thing, because testing is one of the few measures that we have in these data sets that's really tied to an intervention. Because if you do a lot of testing, what that lets you do is make sure that people who are positive, even people who are not badly impacted by the disease, who might be experiencing not much worse than a normal cold, know to isolate for a couple of days. But they don't know to do that unless they've been tested. And so again, testing, you can almost think about it as a progression, and testing is whether or not that first earliest thing in our intervention plan is going well. So seeing some green on the map on the left, that's really, really promising, because it indicates that at least in some places we're starting to have that strategy be more and more effective. When they're dark red, when there's a certain point where you're just basically testing people to confirm that they need a hospital bed, and at that point it stops being effective as a strategy. And so those are the kinds of conversations that are probably happening inside the federal government as they look at this particular data screen.
Moving on to the next very important table, or the visualization. We're looking at the lab test positivity in the last 7 days in comparison to the prior 7 days. So this is a trending report to help us understand whether or not positivity is in an upward swing. And again, we're seeing, what we would expect to see during the time of surge throughout December is that we have increasing lab positivity by county across the majority of the United States, again, concentrated in the same type of areas.
So as we think about this screen, the key thing to remember about both hospital admissions, and then in a second we're going to talk about hospital, kind of the volume of hospital beds taken up, is that it's how full is the hospital right now, and is it getting fuller as we go on?
Yeah.
So this is it getting fuller as we go on?
My mistake. My local slide did not update with the slide that everyone else is seeing. So yeah.
Apologize. When we're talking about hospital admissions, this is the picture that you should be seeing.
Yeah. That's
on the screen right now, and we're probably not going to re-record this because we had a lot of videos to record. So yep. Go to the next slide, and we'll talk about what I was going to talk about next, which is the hospital cases, the ones that are actually inside the hospital right now, hospital inpatient counts.
Yep. So here we're looking at hospital inpatient comparisons over the last 7 days. So hospital inpatients in the last 7 days, the volume of utilization of inpatient available beds. I think this is also part of CDC's collection effort from the individual facility through the state reporting up into the CDC. So they're collecting information from every facility in the United States about the total available beds a facility has, and of those total available beds, how many COVID patients are in them.
So, again, as we look across all these things, there's 2 more geographical analysis that we cover in another video. We wanted to cover all the ones with the 2 maps that really highlight the kind of the state, and then the way the state is changing side by side, because that's the picture, except for the first one. First one was on one side was cases, on the other side was mortality. But for the rest of them, you have these kind of 2 maps that show you what is and what will be, so to speak, if you want to think about it. And so thank you for watching, and I hope you enjoy the rest of our videos.